Perineal massage is a technique that's often suggested to reduce the likelihood of tearing during childbirth. But is it actually effective? In this video, I'll be going over what perineal massage is, the types of tears, whether or not it's effective in actually reducing tears, how the massage is done, and my own personal experience. I'm Annabelle Carney, childbirth educator and physician assistant, and on this channel, I talk about all things pregnancy, birth, and postpartum. So if that's something you're interested in, don't forget to hit that subscribe button and ding that little bell down below so you don't miss a video. The perineum is a small area of soft tissue right between the anus and the vaginal opening. And at first glance, it may seem like a very small and insignificant area, but it actually plays a key role in peeing, pooping, having sex, and giving birth. So underneath that outer layer of skin is the perineal body, and it serves as this attachment point for a bunch of different important muscles. In addition to being so close to where baby exits the vaginal canal, there's also a lot of pressure being placed on this area during that pushing phase. And as a result, this delicate area is so prone to tearing, especially for women having their first vaginal birth. Not all tears are the same. The severity of perineal tears is graded on a scale from 1 to 4, with 1 being the least severe, involving a very tiny tear in the skin that doesn't require any stitches, and 4 being a severe tear that involves the muscles that control bowel movements and usually requires repair with general or regional anesthesia in the OR room rather than in the same room that you gave birth in. So grade 2 tears, they're the most common types of tears, and they involve the skin and the muscle of the perineum and is usually repaired in bed with local anesthesia like lidocaine and some stitches. So a friend or someone you know may have recommended doing perineal massage and swear by it. And some providers may even suggest it and say that it's backed by research. But a lot of times, people will just read the tiny abstract or the summary of a study and just take that as proof that the study worked. But without dissecting the research article, it's hard to know the quality of the study and thus determine if those results can truly be applied to the general population. So, for instance, like what methods were used for the study? Were there any biases? And what was the p-value of the results? Now, I'm not going to go ahead and just get into the details of the studies, but several studies have been done as well as meta-analyses, and they've investigated the efficacy of perineal massage in the prenatal period in reducing the risk of tearing during childbirth. And the results of these studies have been mixed. So some studies showing a significant reduction in the likelihood of tearing, and others showing not so much, no effect at all. However, despite these mixed results, many healthcare providers still recommend perineal massage to their patients. You may be thinking, but why if it doesn't do anything? This is probably because even if it doesn't reduce the risk of tearing, perineal massage can still provide other benefits such as reduced pain with crowning and helping baby's head come out faster, avoiding episiotomies, and preventing more severe tears. And this all has to do with that flexibility of the tissues. So the bottom line is, while there does seem to be some benefit of perineal massage, the difference doesn't seem to be huge. So if you're comfortable in doing it, go for it. But if not, don't stress. But if you're concerned about tearing, I'd focus more so on learning different pushing positions and crowning slowly to allow the tissues to stretch. So to perform this massage, you'll start by washing your hands. No one likes dirty hands near the vagina. And for lubrication, you're going to use a water-based lube or coconut oil that works really well. And you're just going to gently massage the perineal area in a U-shaped manner. So using your thumb, you're going to insert your thumb into your vagina, but not so far in that you're touching the vaginal walls, but just to that first knuckle. So you're going to insert it on and start on one side. You're going to push down and outward and hold for about 30 seconds. And then work your way down and around to the other side. So it's recommended that you start perineal massage at 34 weeks all the way up until the time you deliver. And you'll be doing this anywhere from 3 to 5 times a week for 5 minutes. So there's not one position that you have to do this in, but a lot of people like to lay in bed with some pillows propped up behind them, sometimes even putting a pillow underneath their hips to prop themselves up better so they can better reach around the bump and get in there and massage. Sometimes people also massage in the shower with one foot up on a stool, or do it in the bathroom with one foot up on the toilet, or sitting down. So it's really up to your comfort. But if that's not something that you can get around to, that's totally understandable and not a problem, because then you can ask your partner to help you out with that. So basically, you would lay in bed and have your legs out in a butterfly position, just like so. And then your partner is going to use those 2 fingers and massage that area in the same manner that I had just shown you. So if neither of those were a good option for you, you can always do it yourself with a tool. So this is actually a perineal massager, specifically for massaging your perineum yourself. And basically, you're going to hold it like so, and it has a nice ergonomic grip right here, so that you can go ahead and massage yourself without straining your wrist, and also so you can reach around your big bump, right? Because at 34 weeks, we're not tiny anymore, and your bump gets in the way. So laying down on your back, you would basically be doing the same thing, but now you have the ability to reach around and do the massage yourself. And this is a lot more comfortable from my own personal experience. Now, doing the massage definitely won't feel amazing, but it shouldn't hurt. So it might feel a little uncomfortable for some people, and some people might not mind it at all. But if it doesn't hurt, that doesn't mean that you're not doing it right. Just remember that. As long as you're in there applying some good amount of pressure, you're doing it right. So don't be so aggressive with this area. And now this brings me to my own experience with perineal massage. And I started at 34 weeks, and I did it 3 to 5 times a week for 5 minutes, or maybe a little bit more, up until the time I delivered. So I delivered at 39 weeks. And despite being very diligent about it, I did end up tearing. So as I said earlier, I think it's more important to focus on different pushing positions that work best for your body and allow yourself to slowly stretch. So during my birth, I ended up pushing on a birthing stool, which is amazing because you have gravity here helping push baby down and out. But when you're giving birth unmedicated and you feel that urge to push, sometimes it's so hard to resist that urge to push and let your tissue stretch slowly. And that was the mistake that I did, was that I didn't let her crown long enough. So I did end up getting a grade 2 tear, which was nothing bad. Like I said, that's one of the most common types of tears, and you do heal nicely. You're just sore. So yeah, that's my experience with doing perineal massage up until I went into labor. So that's it for this video, babes. So just to recap, perineal massage is a technique that's been suggested to reduce the risk of tearing during childbirth, but the evidence behind its efficacy is mixed. But even though that there is not significant reduction in the risk for tearing, perineal massage may still provide other benefits by helping stretch and relax those tissues. If you have any questions or comments about perineal massage or just childbirth in general, go ahead and leave a comment down below and I'd be happy to help. Otherwise, thank you so much for watching, and I'll see you in the next video.